This video demonstrates the different assessments for functional movement screening. The deep squat is used to assess functional mobility of the hips, knees, and ankles. The client was given a 2 on this assessment because her upper torso is parallel with her tibia, her femur is below horizontal, and her knees are aligned over her feet. The hurdle step assesses bilateral functional mobility and stability of the hips, knees, and ankles. The client received a 3 on this assessment because her hips, knees, and ankles remain aligned in the sagittal plane and there is minimal movement in the lumbar spine. The inline lunge assesses hip and ankle mobility and stability, quadriceps flexibility, and knee stability. The client received a 3 on this assessment because the dowel remained in contact with her neck and back, there was no torso movement, and the dowel and feet remained in the sagittal plane. The next test is the shoulder mobility test. There is a clearing test for this assessment. The shoulder mobility test assesses bilateral shoulder range of motion. It also requires normal scapular mobility and thoracic spine extension. This client passed the shoulder clearing test and received a 3 for both shoulders on the shoulder mobility test. This is because her fists were within 1 hand length of each other. The active straight leg raise test assesses active hamstring and gastrocsoleus flexibility while maintaining a stable pelvis and active extension of the opposite leg. This client received a score of 3 because her ankle resided between her mid-thigh and her ASIS. The next test is the trunk stability push-up. There is a clearing exam for this assessment. The participant performs a press-up. The push-up assesses trunk stability in the sagittal plane while a symmetrical upper extremity motion is performed. This client received a 3 on this assessment because she was able to perform 1 repetition with her thumbs aligned with her chin. The final test is the rotary stability assessment. The test does have a clearing exam. The rotary stability test assesses multi-plane trunk stability during a combined upper and lower extremity motion. The client received a 2 on this assessment because she performed 1 correct diagonal repetition while keeping her spine parallel to the board and her knee and elbow touch in line over the board.